Broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone, and welcome to today's webinar. We will get started in just about 1 minute. We still have a few people logging in. So we'll give them a chance to get connected. Okay, it looks like the logging in has slowed down, so we will go ahead and get started. Again, welcome everyone. My name is Kim Brown. I'm with the Rural Institute for Inclusive Communities, Transition and Employment Projects, and I will be your moderator for today. This webinar is sponsored by Children's Special Health Services and is funded in whole or in part under a contract with the Montana Department of Public Health and Human Services. The statements shared today in today's presentations do not necessarily reflect the opinion of the department. Please note that all of our attendees are currently muted. This helps to cut down on background noise so that everyone can hear the presenters really well. So if you want to ask the presenters a question or make a comment, please type your question or comment into the chat box. And if you don't see the chat box on your screen right now, look to the upper right-hand area of your screen and you should see an orange box with a white arrow in it. If you press on that orange box with the white arrow, it will open a dialog box or a dashboard. And on that dashboard, you should see the chat or the question area where you can type in any questions or comments that you might have. We will be having a question and answer period at the end of all of today's presentations, so at the very end of the webinar, but feel free to type in your questions or comments at any time, and that way they'll be saved until we get to the question and answer portion of the webinar. Also, we do have the, do want to let you know that the other audience members are not able to see the questions that you type into the chat box, so I will be reading your questions out loud when it's time for questions and answers. For those of you who requested Montana Office of Public Instruction renewal units when you registered, we will email those to you after the webinar, and it can take up to a couple of weeks to get those sent out. Please note that you do have to have pre-registered in order to receive the OPI credit, and unfortunately, we're not able to issue other kinds of attendance documentation at this time. Today's session is being audio taped for the Transition and Employment Project's resource library, and the recording for today's webinar will be posted to the Transition and Employment Training Archives page, which I will put in your chat box in just a minute. It can take about a week or so for us to get the recording posted, so if you're interested in sharing today's information with other people or listening to it again yourself, please check our website in about a week and you should be able to access the recording there. Also, the slides for today's session are already posted on our website if you'd like to download them from our website, or you can go to the handouts section of your dashboard right here on the webinar, and we have PDF versions of today's slideshows available to download during the webinar if you would like to do that. At the end of the webinar today, a survey will pop up. It's just 8 short questions, and we really do encourage you to take the time to answer those questions. We read through all of the survey responses that we receive, and we use those to try to continually improve the training that we're offering. We also use those to figure out what topics we should be addressing in the upcoming webinar sessions. So again, please do take the time to fill out that short survey. I'd like to go ahead and introduce and thank our speakers for today. We are very lucky to have with us Jessie Gill, who is the Children's Special Health Services Health Education Specialist, Caitlin Patera, RN, who is a Children's Special Health Services Nurse Consultant, and Tara Thomas, who is the State Coordinator for the Haley Project Parent Partner Program in Montana. Unfortunately, Brad Thompson, the Project Director for the Haley Project Parent Partner Program, who had planned to be with us this morning, is currently in the air. His flight was delayed, so he is unable to join us. but he does send his regrets, and Tara will be covering the information that Brad had planned to cover. So with that, I am going to go ahead and turn the computer control over to Jesse and Caitlin so they can tell us about the medical home portal. Thanks, everyone.
Hi, I'm Jessie Gill, the Health Education Specialist for Children's Special Health Services. I've been here almost a year, and my background was in Healthy Montana Kids and health insurance previous to that. I'm going to present today on the medical home portal. The medical home portal in 2001 was started with a federal grant by the Utah Department of Health and University Department of Pediatrics. They had seen a need to have all services that the medical home team might need located in one place that could easily be updated and to stay current. We partnered with them in 2014 to make these resources available for Montana families, and it was designed to help children and youth with special health care needs, or CSHCN. They are defined as children who have or are at increased risk for chronic physical, developmental, behavioral, or emotional conditions who require health and related services of a type or amount beyond that required by children generally. The medical home approach is caring for children. It focuses on the patient, their family, and their community. It aims to improve outcomes related to health, relationships, education, and abilities. The portal is a unique source for reliable information about children and youth with special health care needs, as well as all families who are looking to have up-to-date and clinically backed medical information. It's set up as a one-stop shop for families, physicians, and medical home teams and other caregivers. Along with Utah, Idaho, Nevada, Rhode Island, and New Mexico, they all partner with the portal and have these services for their communities in their states. The portal's vision is to have all CYSHCN and their families achieve the best possible outcomes for their health, well-being, and success. But I believe the hope is also to have all families be able to access this information. It's just up to date and useful in their medical lives as well. The mission is to assist and support professionals and families in working together under the medical home model to care and advocate for CYSHCN by providing reliable and useful information about their conditions and caring for them, and knowledge of valuable local and national services and resources that they might not otherwise find on other websites. The portal's long-range goal is to improve the outcomes for children with special health needs and their families, as well as all children, by enhancing the availability and quality of health care, related services, and the coordination of that care. Here's a little pick on kind of what that home screen looks like. We at Children's Special Health Services work to make this information under the Montana Services Directory relevant. And when you do click on that, you'll see the screen pop up here. It's important to make sure that you're in the Montana screen. It does show the other states that are partnered with the home portal here. So on this screen, you can look at categories. There's over 250 of them by scrolling. If you're not seeing what you're looking for, you can always search by term, service category, city, and also state. If you don't see what you're looking for, but you know of a provider that would be useful for the site, you can click on Suggest a Provider. You can enter the information here, everything that you know of that's relevant, and you can submit that, and we can enter that on the back end here at the portal. sorry about that. So if you know of a term that you're looking for, you can enter it out here in the search in the term. I'm going to enter guardianship in Missoula. This particular search will bring up a box here, an alternative to the Guardianship Toolkit that was done by the Rural Institute. In here you'll see the address and some relevant information, and then you can also click on the URL and it'll take you to that document into the toolkit, so you can scroll through there and find some really useful information in there. Now, if you're in here and you see something that maybe is not right, or you would like to suggest, you can also suggest an edit here and enter the information and submit it to us that way. And then we can get that up to date for you. There are several other tabs on this website, and I'm going to, at this time, turn this over to Caitlin Patera, and she can guide you through those other tabs.
Hi guys, my name is Caitlin. As I was introduced, I'm the nurse consultant and program manager for Children's Special Health Services. My background is in pediatrics and spent most of my volunteer work around there. So this is a really great resource for families. As Jesse had kind of alluded, there are multiple other tabs that we can kind of dig deep into, or not quite as deep into, since I have a limited amount of time. So I'll give you a brief overview. So just mark down your questions if you have any of those, and I'm happy to answer them at the end. So the first thing we'll kind of discuss, we can just jump into, is the newborn disorders. Now this tab isn't quite as relevant for this presentation, but I think it just really details what this site can really hold and the information that it can provide. So there is, this lists 37 conditions that are currently tested in the United States here on this side for newborn screening, and it gives just brief guides for primary care teams responding to the positive newborn screening test. So you can click into any of these. We'll just check out cystic fibrosis, and we'll look in here, and this gives information at a local and a state and a national level. So you can see just kind of an overview of what the conditions is, or the condition is, how it's defined, the incidence, maybe other testing that's been associated with that, what that might look like clinically, and some follow-up testing. So this is geared more towards professionals, but it's absolutely relevant for parents to be able to go here and look at evidence-based research related to a possible condition. And then there's also other information resources out here. And then it also has a for parents and patients section that has really relevant, easy to read information, practice guidelines, and of that. So I won't spend too much more on that, but it's really great. And then I'll also just note this green box that's in most of these categories. And they have related links that might be what else is within the portal that might relate to that specific condition, which we'll probably see here in just a little bit. So we can go ahead and look at the diagnosis and conditions also. This is a really cool area of the portal. This is over 50 conditions that they have listed out and evidence-based information related to those. And it also includes practice guidelines, helpful articles, things of that. This is also written more for the primary care team, but again, still very useful for families and patients, or anyone really who's caring for children and youth with special health care needs. So a lot of rich information. We'll just maybe look at Down syndrome. Again, set up very similarly. You can see the roles of the medical home and kind of the guidelines or suggestions that they have for that, the practice guidelines. They even have a clinical assessment, what that might look like for people or providers who are having one of those family members. We have comorbid conditions, respiratory conditions, anything you can think of. This is just really, really great information. So it also has, like I said, clinical assessments, treatment and management, and then services for families. And this is really, really cool because you can click on any of these links and it will directly take you to the location or the resources that are local or statewide. So you can see that there's 2 resources in Billings and a few in Helena. And so that's kind of nice just to kind of tie that together. Next, we'll look at, here, look at the physicians and professionals area. This section is developed really just to help the healthcare professionals in improving care and the outcomes for the children in need with special healthcare needs. And it has really great information about how to build that medical home, all the way down to care coordination and even what coding looks like. And then it has common issues for children with special healthcare needs like toilet training. And it talks about issues involving education in schools, medical terminology, and even screening and prevention, which is really cool. One of my favorite things that I've recently been looking into are these transition issues. And it's kind of set up as a guideline or a time frame. So it talks about birth to 3, and that'll talk about early intervention and even developmental screenings that's related to that population or that age group. And of course, school transitions, 504s, stuff like that. Transition to adulthood, what maybe guardianship looks like, or Jesse has alluded alternatives to guardianship. And then more information related to professionals, and then articles for parents and families. So, and then last, we'll look at for parents and families. Now this is really neat because it's written by parents for parents to just really generally learn how to better navigate their child's health journey. And this is set up from diagnosis all the way to adulthood. And it's more in a what happens next kind of platform. So we're looking at before a diagnosis, what that might look like. Maybe after the child's been diagnosed, what that could look like. Early services, early intervention, again, Part C, education in schools, all types of information about that. Even financing, assistive technology. And then in this legal issue category, there's also lots of really great information about guardianship and laws, even, about parents of a child who is with divorced families, what that might look like. So all of this information up here is just really supporting that medical home. And I'm really excited to introduce Tara. She's the state coordinator, as Kim had alluded to, of the Parent Partner Program, and she is the state coordinator, and she'll be able to kind of dig deeper into what that might look like for families in Montana and how that program supports this medical home.
Hello, everyone. Thank you so much for joining us today, and I look forward to visiting with you about the Montana Parent Partner Program. So just to introduce a little bit about myself, my name is Tara Thomas. I live in Billings, Montana, and I am a parent partner in the Children's Clinic here. I have been very blessed to have the opportunity to serve families in that capacity. In addition to that, I also serve as the state program coordinator. And so I've been doing the parent partner work for about 5 years. And about 4 years of that, I have also been providing some leadership support for the program as well, and have been very blessed to be able to not only work with families, but also support the program from a system standpoint and help build that system of support here in Montana. So I feel extremely humbled to have the opportunity to share a little bit about our program today with all of you. It's something that is very dear to my heart because I myself am the parent of a child who has special needs. I have a 13-year-old daughter who has some particularly complex developmental and medical needs, and she is what brought us to this journey to begin with. If Brad were here, what he would tell you is that this isn't a journey that he chose for himself, and that he's also extremely thankful that he didn't have the opportunity to choose. I would agree with those statements as well. This is certainly not a role or a position I had ever envisioned myself being in. I think a lot of people are kind of live in that myth that all children are born healthy without complications, and what families who live in this realm quickly find out is that isn't always true. And so just like Brad, I am also extremely grateful that I didn't have the opportunity to choose because I have been blessed in some absolutely phenomenal ways as a result of having my daughter, and have been extremely blessed to have bumped into some extremely amazing people along the way. So thankful I didn't have the opportunity to choose, and you just figure things out as you go, and that's where the Montana Parent Partner Program has the opportunity to really step in and help provide some of that support to families. We have been very, very blessed here in Montana how this program came to be. It initially was provided through some grant funding through the Mountain States Genetics Regional Collaborative, and we were able to launch the program in Montana and Wyoming 5 years ago, and then have been incredibly blessed and very well supported. In about a year and a half into that, the Montana Department of Public Health and Children's Special Health Services stepped in and not only supported what was in existence, but expanded the program and continues to be one of our biggest supporters. So we are extremely grateful for the support we get and for the ability to offer this program in Montana. So let me move to the next slide here. All right, so in April of 2016, the Haley Project's Parent Partner model was selected by the American Academy of Pediatrics to be an innovative and promising practice in the pediatric medical home implementation. For those of you who may not be familiar with the concept of a medical home, it really is a way of providing comprehensive, coordinated care for families. So the idea isn't that your home becomes a medical office. The idea is that you have a provider in your life who sort of serves as your home base, where you can go to that individual and they would have a comprehensive picture of the complexities of your child and the diagnoses, the support systems that are available in your community. And by having all of that information housed in one spot, which is referred to your medical home for a lot of people, it's their pediatrician. For some individuals with extremely complex medical needs, that may be a specialty provider or a subspecialist on your medical team. So to be recognized, for the Parent Partner Program to be recognized as a model that encourages and supports the medical home initiatives that continue to expand and grow across our country is a pretty significant honor. And so we're extremely proud of that and thankful that what we see as parents as being supported is actually being supported in a real systemic way on a national level as well. So why parent partners? Why are parent partners so important to the work that we do and critical to the concept of a medical home? Basically, since the beginning of time, parents have wondered if they're doing it right. We always want to learn from people who have come before us. We know that a lot of that teaching is tried and true and extremely important. I know one of the phrases I hear commonly is that it takes a village, and we're always looking for people to help us navigate that journey. One of the things that makes that really challenging if you are the parent of a child that has special needs is that finding those people that you can refer to help you navigate that journey becomes a little bit more difficult. In most instances, many of us don't have access to people who've ever experienced anything like what we're experiencing as parents. So that can really be isolating for a lot of families, and isolation doesn't lead to anything good, unfortunately. So the goal of the Haley Project's Parent Partner Program is that every patient and family and caregiver group of a child who has a complex medical need or special health care need would have access to a parent partner to help reduce that isolation so that they can build a relationship and just have that support throughout their journey. Our goal is for that to occur regardless of where they live. Currently, our program is in pediatricians' offices primarily, and community health centers, where we're exploring other options as well, and our program continues to expand as time goes on. So all of those things are fantastic, and why we believe having access to a parent partner is phenomenal. So part of the research has indicated that there are some pretty common elements of successful support. One of the things that has been really fascinating for us as a program, as we experience what we as families and parents know to be high quality support, it's been wonderful to see that research exists and continues to occur that supports the principles that we as families know to be true. One of the things that is being explored is what does constitute successful support, and then what does it mean for that support to be provided by a peer? So among the things that are elements of successful support are things like having a shared experience, having a safe and supportive environment that allows people to speak freely and not feel like they have to be guarded in the stories that they share. Training, that the individual that's working with families is equipped with the skills they need to support those families well. The mutual support of support givers is also extremely important. To have the opportunity to share those experiences that are beneficial to families and offer support. Ongoing supervision is also critical. One of the things that is common in the helping industry is burnout. A lot of that stems from, again, the caregivers and those providing support feeling isolated and not supported. So having the opportunity to support our parent partners is pretty critical in that they themselves, one of the requirements of our parent partners is that they have to have a child with special needs. So in addition to helping to provide support to other families who have children with special needs, they then go home and still need to be a resource for their individual family and spouse. And so we think it's extremely important to support our parent partners in their life and as they're supporting other families as well. If we're going to ask them to take on the additional responsibility of other families, we want to make sure that they're supported well in that. So that is one of the aspects of our program that is fundamental to how we engage and work with the program and our families. So of all of the items that have been indicated as successful support methods, the Haley Project Parent Partner Model has incorporated all of those into the program that we do. They were always there. It's just fantastic to have the research that supports that as well. So what are the goals for the Montana Parent Partner Program? It's that we as a program would help support and provide that high quality comprehensive care that extends beyond the medical arena. For families like ours, we know that the medical aspect of our children is just a small sliver of what we as families engage with all the time. So to be able to provide that support and comprehensive care that extends beyond just the medical arena, but into the social supports and the emotional supports, particular issues that families encourage or encounter on a regular basis, things like schools and therapies and those sorts of things that just are a little different for families who have a child with special health care needs. So we love to be able to step in and help support those families in those areas. Greater patient and caregiver satisfaction. Oftentimes, a lot of our families feel isolated. So being able to step in and provide that high quality care. So it's not just the emotional component, but oftentimes our providers step into that role because the providers that service our kiddos are phenomenal providers, but that has a tendency to cause other things as well, and it's sometimes hard for our providers to have that time even though they want to provide that support. So having a parent partner in the practice allows the opportunity for patients and caregivers to feel supported, and that increases their satisfaction in their experience. Improved health outcomes and quality of life. One of the things that we think is extremely important is that we spend our time and our effort and our energy on the things that will matter and make a difference and help our families reach the goals they have for their children. So if we can improve those health outcomes and overall quality of life for the child, we know that that also improves quality of life for the family as well. So it's a real holistic perspective that seeks to not support just the child, but truly the child and their network of caregiving individuals. Decreased caregiver stress and isolation. One of the things that we hear frequently from our families is that they feel like they're alone and by themselves and having to navigate this journey. And then when you've got complex medical difficulties, it involves a lot of therapy appointments, a lot of physician appointments, and that oftentimes serves to only increase the isolation because it's harder to have those spaces in our life for those casual interactions. And in some instances, due to the diagnosis of our child, it's harder to have those sorts of interactions on a spontaneous way. Better time efficiency for the practice. Having a parent partner in the practice allows the provider to be able to get to that next patient a little bit faster. We know that all of our providers and many of us have been the other individuals sitting in the waiting room waiting for our appointment. So again, most of our providers step into those conversations, but if the provider can refer that family to a parent partner, it allows that family to feel supported better in that they're having the opportunity to have a conversation with someone who lives a similar life. And that alone is able to help reduce some of that isolation and improve the efficiency for the practice. Higher job satisfaction for the provider. Again, the argument I would make is that our families are serviced by phenomenal providers, and they hurt and feel very deeply for our families as well. And so it's hard for them to not be able to step in and provide those supports or access to things that are in the community when they know that the family needs that. So it allows some job satisfaction for the provider, and that the provider is able to step outside of that room and know that the family that they care so much for is truly going to be supported well by a peer and someone who knows what that life is like. So one of the things that we think is really important is that our program provides a win-win-win opportunity. It's an opportunity for the family and the child to win, because when our families and our children are well supported, the outcomes have a tendency to be significantly more successful. We know that it's also a win for our providers in that it allows them to practice at the top of their license, to support their families well, and yet step outside of the room so that they can serve another one of those patients that's been diligently waiting in the waiting room. And then we also believe that it's a win to the system and our community. We're able to connect our families to services that already exist in the community. And in doing that, our families are able to be serviced well, and the organizations are able to connect to the population and fulfill their mission of serving individuals as well. So we also believe that this is a cost-effective way to support families. The reality is a parent partner makes significantly less than a physician, and so it's a way for us to provide high-quality support and that comprehensive coordinated care at a more efficient cost. So who are we trying to serve? We're trying to serve any family who has a child with a special health care need. One of the things that has been a phenomenal blessing of partnering with Children's Special Health Services here in Montana is that we use the definition of a child or a youth with a special health care need as defined by the Maternal Child Health Bureau. And what that definition tells us is that in order for a child to be qualified or designated as having a special health care need, that would be any child that has a need that would be beyond what a typical child would need. So if you think about the population in states like Montana or other states that have significant rural populations, in most cases, all of our children either have a special health care need or at risk for a special health care need. And if those are true, then we are certainly able to serve and support that family. There are no costs to the family for the services that we're able to provide. So it's just a really nice entry point, particularly as funding continues to tighten in our state and across our country for services and supports for families. The Parent Partner Program is able to provide some of those supports for our families. That isn't always the case for some programs. There are some programs that have requirements in order to be able to participate in the program. So we feel extremely blessed to be able to offer this to everybody. So the benefits of the parent partner model, and this is something that I encounter every single time I work in the clinic. Moms and parents and caregivers are oftentimes willing to share with another mom things that they are extremely hesitant and sometimes unwilling to share with providers. So there's just a camaraderie that exists in that, and a comfort and a safe place where moms feel like they can share with another mom. What that does for the family is it allows us to figure out what is the real issue underneath the issue that we're seeing in the clinic, and then how can we help support that family so that that's not an issue anymore. So having the opportunity to build that relationship with that family and establish that trust where those families know that they can share anything they want to with us and there will not be any judgment, any of those sorts of things, just really provides families an opportunity to feel comfortable to share. And that is something that I experience every day. Parents with experience in the world of special needs know who to talk to. So one of the advantages of working with a family who's already been through a similar experience is oftentimes they're able to tell you not just the phone number to call, but who to talk to at that organization. And that allows a lot of our families to get the help they need a little faster because they aren't having to jump through all of the hoops. There's somebody who's already kind of walked through that maze that can help get them on that journey a little bit quicker. The other aspect that is particularly beneficial is that parent partners are far more available between office visits. So it's a lot easier to call and schedule and make an appointment with a parent partner or either in person or over the phone and get the support they need as opposed to coming in to see their provider. So it's an opportunity again for those parents to just have access to support when they need it. What a parent is able to do is to encourage the parent of the child to take those necessary steps to help improve those outcomes and provide better care. So families are more willing to engage and take those steps if they have somebody else saying, yes, I've done that too, and it was really helpful. So a parent is far more willing to pick up that phone and make that phone call and get connected. Again, we've already talked fairly extensively regarding the isolation component. What research tells us is that isolation leads to depression at times, a variety of other difficulties and struggle, and none of those things are helpful to our children. So if we can help reduce depression by providing support and reduce those feelings of isolation, chances are our families are going to have improved emotional health and feel supported along the way, which is certainly in the best interest of the child. The benefits to the providers, we've already talked quite a bit about some of those. It allows the provider the opportunity to spend more time at the top of their license. There are things that they do regularly that are time-consuming and in our current structure oftentimes are not reimbursable. But most of our providers step into that role anyway because they know how critical that need is for the families. So again, if that provider can pass those responsibilities over to a parent partner who can then support them better and from a personal perspective standpoint, oftentimes it's beneficial for the families. And then a significant number of those are non-medical in nature. One of the benefits of what we do is that we truly are working on building lasting relationships for our families. Our desire is to be more than just a resource. Obviously, resources is a part of the work that we do, but it's the emotional support and walking with the family on their journey that is extremely beneficial when it comes particularly to the emotional health component of things and reducing those feelings of isolation. So we're able to help that family identify what is the best possible life and then support them along that journey, again, which is certainly beneficial to the child. We can teach and model healthy communication in spite of overwhelming emotions. Oftentimes families spend a lot of time in that fight, flight, freeze mode, and so we're able to coach families and help them have the skills they need to recognize when those systems are rising up and take steps so that they can engage in healthy communication and build teams of support around their families rather than having some unhealthy relationships that they really need in order for their child to be supported well. We think transitions are phenomenally important in life, but they oftentimes are filled with a lot of uncertainty, and uncertainty for a lot of families creates some stress and unrest. So having somebody who's familiar with the family to help walk them through that is helpful. We can encourage the marathon pace and not the sprint. We see this a lot of times as we're working with families that particularly in those young years when things are fresh, families really dig in and work hard to support their families, and we certainly think that that is wonderful. But we also need to make sure, or to do everything we can to support that marathon pace. It is a marathon for most of our families. They're going to be providing support for their children for a number of years. And in doing that, we want to make sure that they're just as fresh and passionate about doing that when their child is 6, 8, 10 years old and well beyond into adulthood for some of us, that the family is still engaged and actively participating in that process and not burnt out and struggling. So the Parent Partner Program is able to help provide those supports, and again, it goes back to that isolation piece to try and avoid that burnout and help them have positive, healthy interactions with people. So what does it look like in practice? It begins with a referral. That referral can come from inside the clinic. It can come from an outside organization. It can really come from a variety of places. And it's referring a child or a youth with a special health care need and their families or caregivers. So physically in the practice that I work in, that can mean an email from a provider. It can mean turning around in my chair and I'll have a provider standing behind me who wants to tell me about a family that's in the clinic that they think needs support. Sometimes those providers the providers send referrals to me via email because the family is no longer in the clinic, or I wasn't in the clinic when the family was there. And then we certainly reach out and connect with that family, again, either while they're in the clinic, on the phone, virtually over a secure connection, or at another arranged time. And again, that points back to the idea that our parent partners are typically more available than our providers, so we're able to work around the needs of our families. We're able to support, encourage, and point families to hope. And that oftentimes carries a little more weight when it comes from somebody else who's already living that same sort of journey. There are some things that are just very unique to living life with a child who has special health care needs, and a parent partner is typically more able to relate and convey that understanding to a family because they live the same sort of life. This support regularly continues throughout the family's journey. I shared earlier that our goal and our desire truly isn't to be just a one-stop resource. We want to partner and really get to know that family so that when the family experiences something unexpected, we already have that relationship with the family and we're able to provide the support that's needed. We also love hearing and celebrating the victories that our families experience. Those victories oftentimes are hard won, so we rejoice with the families in that, and it's that helps spurs us on so that we keep working on the next goal that we have for our kiddos. There are many access points and sources of support for our parent partners, our host site leaders and locations, and our program partners. One of the things that we think is extremely important to this program is that, again, as I've already shared, if we're going to ask people to step into this support roles and take on additional responsibilities, we want to make sure that we do all that we can to support that well. So we engage in a variety of activities throughout the month on a regularly occurring basis that help support our parent partners and everyone who's associated and connected with our program. So to share a little bit about what our program has been able to do thus far, from May of 2015 to June of 2016, we were able to service, or blessed to service, 500 different patients with over 2,500 separate issues and challenges. A variety of challenges or circumstances are addressed in that. About 450 of those were emotional support, whether that's helping that family walk through the grief and acceptance process. Family relationships, oftentimes we hear about families who have difficulties within their immediate family and beyond. Grandparents raising grandchildren is another aspect of care that we're certainly seeing on the rise as time goes by. Our families need access to community resources. Sometimes that's basic needs, sometimes it's beyond basic needs. School-related difficulties, oftentimes our schools are not familiar with working with the unique aspects of our kiddos, and sometimes that can create some challenges, so we're able to work with families to try and encourage positive and successful outcomes in that arena. Care coordination, a lot of our families have children with extremely complex care needs, and so we're able to help support that. Being in Montana and from a rural state, a lot of our families travel to get the medical care they need, so we're able to assist and help families get the help and support they need with that as well. We experience families that are having difficulties with food scarcity, clothing, utilities, housing, behavior and autism spectrum disorder related difficulties as well. So really there's not much that we aren't able and willing to step into and support. And then we certainly believe very strongly in collaborating with community partners as well. So we can get families connected to the community resources that they need and get the support they need in those areas as well. More recent figures for the program from July of 16 to June of 17. We've served over 400 different patients in more than 1,500 encounters, yielding roughly 4,500 separate issues and challenges. So these are families with a lot of complexity, which again encourages that isolation, unfortunately, because there just aren't many people who understand and know how to navigate the complexity of complex conditions and situations. So we feel very blessed to be able to step in and provide support and encouragement for those families. So about 37% of that is spent following up and partnering with the family in their unique journey. We encourage our families to dream new dreams for their children. We think it's important for families to identify that appropriate, realistic goal and then work towards actually achieving that for our children. So again, that points to the importance of partnering with the family for the long haul. And that's something that our program certainly encourages and supports. About 27% of the time spent on those encounters was to connect them to resources or refer them to other supports that exist in the community. Family support and reassurance was about 14%. And then we had a miscellaneous category that we pulled together all of those other little things that didn't fit into other categories. So things like school, care coordination, guardianship and transition. We have some phenomenal resources in our state for guardianship and transition through the Rural Institute. So we're thankful to be able to partner with individuals to make sure that our families are supported well. Basic needs, travel, respite, insurance assistance, durable medical equipment. There's really just a variety of things that we work with our families on. So where are our programs currently located in Montana? We currently have the practice that I work in, which is the Children's Clinic of Billings. And so we have 2 parent partners who work here. We are also in Bozeman Health Pediatric Clinic, Southwest Montana Community Health Center in Butte, Benefits in their pediatric clinic in Great Falls, Missoula Valley Pediatrics in Missoula, obviously. We are extremely excited to be partnering with Shodair and the Children's Hospital there in their genetics side to support families who are receiving new diagnoses and then also diagnoses with chronic conditions as well. So that is certainly another one of those struggles that doesn't, it changes, but in most cases it doesn't always go away. So providing that family support is important in that arena as well. We are also working to support the deaf and hard of hearing population across Montana. That is another unique population that just experiences isolation in a unique way. So we're extremely blessed to have an opportunity to step in and bring our program to that very specific targeted population as well here in Montana. So what if your child doesn't go to one of these places? We are currently in the process of expanding to a couple other clinics across Montana, and we certainly look forward to what is to come there. So stay connected to that Department of Public Health website and the Montana Parent Partner Program area, and you'll be able to see the locations we're in. In addition to that, we are also actively working on a virtual platform so that we can support families all across Montana. We certainly know that in rural Montana, the challenges in those areas, particularly across the Highline and eastern Montana, they experience unique challenges that those of us in the more metro urban areas don't experience. So we're working on finding those ways to support those families, and we're hoping to be able to offer that here in the next year or so. So very exciting for the program. So with that, I believe my part of the presentation is completed, and I would love to pass the webinar over to Rachel and Caitlin to discuss how the program is supported. I've shared throughout this message that we're supported through the Department of Public Health and Human Services, most specifically the Children's Special Health Services Division. We've been very supported, extremely supported, and supported well by Rachel and Caitlin. And so I just want to have an opportunity to let them speak about how the program is supported here in Montana.
Thanks, Tara. Well, I think that, that was kind of a really good prelude. I don't have much more, I guess, to add to that other than we do have a partnership, and Rachel and myself and Jesse, Rachel wasn't able to speak this afternoon, but we are a part of the Department of Public Health and Human Services, and we are in the Maternal Child Health Bureau. And so we are primarily funded by federal Title V. The Maternal Child Health Block Grant. So every state has one of these grants, and 33% of our funding is dedicated to support children in the use of special health care needs. And where we choose to kind of focus that funding this year is that we're focusing on the medical home portal, the medical home, improving that, and we're working on transition as a whole also. So how we do that is right now we're helping the parent partner program expand and giving them support where we can, and focusing on that medical home portal, which is of course what I had just briefly presented, Jesse and I, and then partnering with the Rural Institute to work on transitioning. So again, that kind of sums up us and our presentation. So we'll go ahead and open it up for questions, but first I just really want to thank you guys for being here and just kind of listening to us talk about some of the stuff that we're doing to help kiddos with special health care needs. And if you have any questions, I just encourage you to reach out to me or Jesse or Tara or even Kim at the Rural Institute. And we're happy to answer any of those questions now. So, and I will just let Kim go ahead and take over.
Great. Thank you very much, Jesse and Caitlin and Tara, for the information that you shared today. As we mentioned, we do have time for questions and answers now. So if any of you have anything that you would like to ask one of the presenters, please go ahead and type that into the chat box. If you don't see the chat box, click on the white arrow that's inside of an orange box toward the upper right-hand area of your screen. That should open up the dashboard and allow you to type in your question. We do have one that's come in, just a suggestion or a comment that maybe someone could mention the Great Beginnings Conference that will be held in Helena. Do any of you have information about the conference?
Oh, sorry. Yeah. So that the Great Beginning, Great Family Conference is going to be in Helena, and that's going to be on August 14th and 15th. And so that has we can definitely send you guys a save the date and give you a little bit of background on what that conference is going to hold. So that has a whole bunch of information on subjects such as breastfeeding and transition and self-care and program updates and a lot of really, really great information related to that. I know that there's going to be women's and men's health having some tracks there. So home visiting stuff. So I think it'll be really great. But yeah, we're welcome to share that information too. That's a great suggestion. Thank you, Teresa.
Thank you. Next question. Are there any providers lining up in Helena to participate in the medical home portal in the near future? And we may need a bit more clarification about the question there.
Yeah, I'm happy to answer that question too if I'm not answering it correctly. Maybe clarification in the comment box, but if not, certainly you can email me. But so there are several resources that are associated with Helena, like in the resource directory. So, gosh, I don't even know how many resources we have listed for Helena. So if we're talking about any, if that question is more related to the parent partner program, and if there's any providers in line for Helena, you know, that is a process that we have been looking into, but I don't think anything has been solidified at this time. Tara, you might be able to kind of speak on that behalf a little bit better than I, but I don't know. I don't know if that helps at all.
Mm-hmm. So one of the things that is great about the medical home portal is you don't actually have to sign up in order to be listed on that. Again, if I'm understanding the question correctly, you don't have to sign up in order to participate on that. Really, it's just an information source. And I know there has been some pretty significant effort over the last handful of years through efforts with the Rural Institute, Children's Special Health Services. The Montana Parent Partner Program is also supporting those efforts as well to populate those resource fields. If the more resources and information that we can get out there on that medical home portal, the more useful it becomes for all of us. It really is an opportunity to have a one-stop shop for a lot of the services and supports that exist across Montana. But in order for that to happen, we have to make sure that all of those are in there. Obviously, having local knowledge of that is helpful because I think all of us know and recognize that our communities change periodically, so or maybe more frequently than periodically, but keeping those updated is what's going to help that medical home portal become more robust and continuing to be useful. So it's a phenomenal opportunity. I know it's used in other states as well. It really is an amazing program. So if I would encourage everybody, you know, Jessie walked through that when she did her part of the presentation and what it looked like to add resources to that. So the more people can suggest, if you know of something unique, please certainly go out there and submit that so that it can get listed out there. And then if there are any changes, you know, review that information periodically and then we can get it corrected and make sure that we're serving our population to the best of our ability.
Thank you. Any other questions from audience members? Now's your chance. And while maybe we're waiting for people to type in any questions that they might still have, I do have just a few housekeeping kinds of remarks. A reminder that a short survey will show up as you exit the webinar today, and please do take the time to answer those 8 questions. This is our last webinar of the season, so we don't have any additional training scheduled at this point in time. However, we will be working over the summer on our 2018-2019 training calendar. So on your survey, if there are specific topics that you would really like to see us cover in the fall and next winter, please include those on your survey response. The recording from today's webinar will be posted to our training archives page. And I did put the URL or website address for that in your chat box, so hopefully you'll see that. Again, it can take about a week to get posted onto the page. Any other questions from anyone or any final comments from any of our presenters today?
I just really would like to take the opportunity to thank everybody who attended the webinar today. It's fantastic to be able to share some of the work that's being done in Montana, and we hope it was useful information for you as well.
Great. And I'd like to thank also, this is Kim, and I'd like to thank all of our audience members as well and our presenters today, Jessie, Caitlin, and Tara, for taking time out of their busy days to share this information with us. We are finishing a bit early because Brad was not able to be here and because we didn't have as many questions as we anticipated. So I would encourage you to take a few minutes, since hopefully you had the full hour and a half blocked out on your calendar. I would encourage you to take a few minutes and go to the Medical Home Portal website. Just take a look at the resources on there. I know the first time that I actually spent a few minutes and dove in and clicked around on the screen, I was astounded at how much high quality information was there. I think it's a fantastic underutilized resource probably. So do take the time and look at the Med Home Portal. And again, thanks to everyone, presenters and audience members. Have a fantastic afternoon.